Hello, and thank you for tuning into this video. I'm sorry I've been absent for a while. I've had a lot to do with my day job. I wanted to start today instead of with the statistics about COVID, but say thank you to people that are fighting this epidemic, and that could be medical health professionals, public safety, it could be Amazon Prime drivers, grocery workers, etc. It's a really difficult thing to be out there right now, and I appreciate that. So I'm going to talk about models again because I'm still steamed, quite alarmed actually, that the Chris Murray model is still getting tremendous traction in the media when it has failed to be reliable. So at this point, 24th of April, we've got almost 3 million cases and 200,000 deaths that we know of, and we know that those are both underestimates and is still growing. So with the Chris Murray model, what I said last time was I object to three things: the way the model's been presented, the model itself, and the continuous radical updates. So the model's always been a moving target because every 2 days or 3 days there's another release which has different methodologies and different predictions and so forth. So that's a problem in and of itself. So even if one of them was good, it would be different the next day anyway. So I'm going to show you a couple things about the multiple releases of the model and really emphasize the lack of predictability and the lack of stability as an important component of that, because they've now switched from predicting just sort of accumulated deaths to the COVID in the US, but to when we can reopen different states because of low incidence of the coronavirus infection and so forth. So they're now switching and adding new predictions that are aimed at policymakers that I think are probably going to be just as unreliable as their previous predictions. So that's the important thing. Their website, as always, is actually stunning, and I have to give them kudos for putting all of their estimations up as downloadable Excel files or CSV files, so you can get data from each of their model releases from the very beginning, and I've done that in my analysis, and that's a really important thing to do. So kudos for that. They've had something like 35 press highlights that they've put up on their website, including being interviewed on Fox News, or actually more recently NPR did a story, and in that they talked about the fact that the criticism of his model was inappropriate because that's not how models work. Models aren't wrong. They just help you understand the world, and I think that's completely and totally false. There are models for which you are trying to understand process, and it's not a matter of right or wrong. But if you're making a model that's predictive to guide public decision making, which is what this model is billed as, then it lives or dies by its predictions, and its predictions are wrong. And that's an important point. So, as I said, they've made it very clear in their FAQs that this is to be used as a real-time planning tool for the allocation of health resources, ventilators and so forth, and now in the new world to when we can sort of start to ease up on our social distancing edicts. And if those predictions are wrong, people will die, and those predictions I think are wrong multiple times. So what have they added in the more recent releases of the model? Predictions for countries in Europe. I don't believe that they've proven that they can predict in the US correctly, let alone add countries in Europe. They've added the provinces of Canada, and now, as I said, the social distancing measures. But I really want to ask the question, is the model trustworthy? Because if it's a predictive model and it's not predictive, then anything that they build on top of that foundation is going to be just as flawed, maybe worse. So I'm going to approach this from a couple of ways. I'm going to look at the parameters of the model because they have a couple times changed some of their methodologies. And when you look at the radical changes that have been made, it makes you wonder why we could possibly trust modeling. I'm going to look at the prediction for the U.S. for total deaths and how that's varied over the last 10 releases of the model. And then I'm going to look at the variation among states, which is much more pronounced. All right, so model parameters. In virtually every release since the beginning, they've had this description of changes, and they talk about more data, better models, and growing evidence that we can improve our predictions. I'm going to argue, in fact, that their predictions are getting not better, maybe worse, with each new iteration of the model. So I think it's untrue. This is an example of one of the things that they published as part of the change from the April 2nd to April 5th model. So they had originally thought that on April 2nd, right here, that the U.S. would peak at 2,644 deaths per day. And they had, in the next iteration, which was released on the 5th, it was now raised to 3,100. That's 500 deaths per day, or an 18% increase. They changed the cumulative total from 93 down to 82, which is a 13% drop. They actually believed that the ventilators that needed to be used dropped from 30,000 to 18,000. That's a 40% drop. And part of that is because some of the parameters that they were using in the model, they updated. So on April 2nd, they would use a time of from hospital admission to discharge with an ICU stay, that is in the intensive care unit, of 8 days. So if a patient was admitted and was eventually in the ICU, that they would on average be in the hospital 8 days. It turns out it's much, much longer, and they changed that on the next iteration to 20 days. So that's a 150% increase in the time a patient stays in the hospital. And it's mostly due to this huge increase in the time that they're staying in the ICU itself. And they also changed the time that it takes for those that do die. They had it set at 8 or 10 days depending on age, and they updated it to 6 days. So that's a 20 to 40% change. So they've got model parameters changing by 20, 40, 100% in back-to-back releases of the model. And if we can't even get the order of magnitude right for our parameters, why would we believe the model works at all? So this was another release on April 10th, and they said that on April 10th there are 0 days until we hit the peak. The peak was predicted to be that day at 1,983 COVID-19 deaths. So they were predicting literally that the day that the model was being released, we were at the top, and it was going to be all downhill from here. This is the information from the New York Times daily counts, and this is the 2,000 bar, 2,000 deaths per day. This is April 23rd. So the 10th is way back here. And we've been over 2,000 deaths now, 1, 2, 3, 4, 5, 6 times in the last 2 weeks after that. So not only was the peak dramatically wrong, it's much higher than 2,000, we've exceeded it multiple times in the 2 weeks following that prediction. So that prediction was completely unhelpful. This is actually how the predictions have changed for the total deaths in the U.S. In the very first release of the model on the 27th of March, that was 82,000. On April 1st, they raised it to 93,000. By April 8th, they had dropped it to 61,000, and it's been fluctuating and up now. The most recent version is 67,000. So the range is from 60,000 to 90,000 deaths, and some of those changes are made in literally back-to-back releases of the model a day or two later. So that's that total deaths in the U.S. That's the largest, sort of more aggregated, hopefully more stable element to the model, and it's varied quite a bit. And this is just the mean that they're predicting. It doesn't even talk about the variability. This is the trace, for example, on their April 1st release. The observed data is here in these gray circles, and then their prediction is this gray line in the middle, and the confidence intervals around that are the red lines. So they predicted it would peak sometime around April 15th or 18th on April 1st. And they thought the peak would be around 2,500 cases, which ended up being pretty close to right. But by April 10th, they had changed the estimate and made it lower and sooner, which was wrong. So their older estimate was actually better. But notice that the confidence interval goes from something like 1,000 to 4,000 deaths per day. So that's a fourfold range. So that's a pretty wide range. And the actual data that's filled in since that prediction was made is in blue. And if you look later on at the predictions that were made just a couple days ago, and you have all this new data, they have their prediction is that we're just going to slide down. That if you look back, they assumed, I went the wrong way, they assumed that we're going to be heading down fairly predictably and fairly steeply in May. And even though we've had this long protracted 2,000 deaths per day period that they did not predict, they still believe that in May it's going to drop very steadily and in fact more quickly than before. And I think there's absolutely no evidence that's the case. In fact, I think there's evidence it's the opposite. And this is that evidence, okay? This is the New York Times information from today. This is the daily number of cases reported and daily deaths. We know that deaths lag behind cases by about 10 or 12 days because it takes a while for the illness to really get going in someone and really challenge them. So if we look at our cases, the prediction of their model was that it would rise, hit a peak, and quickly start to fall off like was reported from Wuhan, whether we believe that or not. And that's this fall off you see right here. Now, we're not tailing off hardly at all, maybe not at all, right? And as of today, we have 46,000 deaths, and we're getting about 2,000 deaths a day. And we're going to have at least another week or 10 days of that because we haven't started to decrease yet. So the people that are sick now that will die over the next week or 10 days, there's probably 14 or 18,000 of them. That'll put us at 65,000, right? Their best guess is 67,000 as of yesterday. And we're going to hit that in less than 2 weeks, and we're going to still be going strong. So it's just in my mind inconceivable that that's a reliable estimate. Maybe they'll prove me wrong and they know more than I do, but it seems to defy logic that if the cases are not going down now, we won't see deaths going down for at least another 10 days or 2 weeks. This is one of the updates where they showed the predictions changing for New Jersey. And this was March 30th and April 1st and then April 5th. And then they combined them here. And I think that there's a great book called How to Lie with Statistics. And one of the ways you do that is you present graphs and you change the scale without telling people. That's 400. This is 2,000. This is what it should look like when they're together. They're predicting 400 deaths, and several days later they're predicting 2,000 deaths with enormous variability. So it's bouncing up and down in terms of the prediction very, very dramatically. And if you put the error bars on it, oopsie, went too far. The error bars are sometimes so large as to be unhelpful. So for the estimate from the 5th of April, they estimated 10,000 deaths, with an error bar from 2,500 to more than 15,000. Well, if you're a hospital planner for New Jersey, 3,000 and 10,000 and 13,000, they're very different. And so that level of uncertainty makes that day's prediction useless. And of course, the next day the prediction's halved, which makes it even less helpful. So sometimes they have very narrow prediction intervals, sometimes much broader, but you can see that they've bounced around. And this was their first prediction down here, and this was the actual data. So the prediction on April 1st was dramatically wrong for Jersey. That was this low prediction here, and all of a sudden they realized that Jersey was getting hammered, just like New York was, just a little lag behind them. So on the on the 5th estimate, they had upped it quite a bit, and the uncertainty bar really rose over the period of time. So their best guess was this gray line, and what really happened was a seesaw thing. And now, as of their most recent model, we have this data in the bank, if you will, and now they believe New Jersey is just going to slide down very quickly, like they do for most of their predictions. Here's Texas. They thought there would be 5,000 deaths for a couple of iterations, and they changed it to 2,500. Now they're down to about 1,000. So their initial model was it would peak late in May at a couple hundred deaths per day, leading to 5,000. On the 5th of April, they said, well, no, it's going to peak earlier in late April with only 50 or 80 deaths per day and leading to 2,500. And now they say, no, it's peaked, and we're not going to see anywhere near even 50 deaths a day, and we're going to total something like 1,000 or 1,200. So you can see the dramatic change in these red lines and how much uncertainty they're allowing for. And in every model, though, they come down very quickly and very deterministically within about a month, usually in May. And that's based largely on what we saw and what was reported from Wuhan. Connecticut, they started out with a very low estimate. They saw data showed increasing cases. There was a huge increase in the estimate from about 1,000 to about 5,000, and then they revised it back down to about 2,500. These are the predicted epidemics in the gray and red lines from the 1st, the 5th, and the 22nd. Again, very, very different. I've always, in each of these graphs, they're on the same scale, so they actually can be compared directly. So what do I think by state? Volatile, huge changes in the estimates, even bigger error bars. It's not a predictive model that can be used. It cannot be used for management for any kind of decision making in a predictive capacity, because the predictions will change by tomorrow, and oftentimes older predictions are actually more accurate than newer ones. It is whatever. So I've been steamed about this for several weeks, and I've done several videos about this. I wanted to point out that there's now a growing literature of other statisticians and epidemiologists who have become more vocal or about the what we perceive as enormous weaknesses of the Chris Murray model, the IHME model. This was a group that included some statisticians from Australia and a couple places in the States, I forget where. But they were looking at predictions on different days. These are predictions on the 30th of March and the 31st of March, and they were looking at whether they were above or below, whether the observed deaths several days later were above or below the prediction, and were they inside or outside of the confidence intervals. And what they found was that there were days when their estimates were mostly overestimates, and other days when they were mostly underestimates, and that about 50% of the time the estimates were outside the 95% confidence intervals. So that's an error rate, instead of 5%, it's about 50%. So it's much, much worse than it's much less reliable than it bills itself, even at that point. And now, of course, they're taking that model and they're estimating when we're going to reach a certain threshold in cases so that we can start to open up states from these more restrictive measures. Now, they've only been doing this for a couple of days. On April 17th, for example, they predicted in North Dakota that they would be able to release on the 29th of June. Now, this is 5 days later, and they're predicting July 20th, essentially, so that's a 20-day change in the last 5 days. Arizona, the 8th to the 26th, 18 days. So you can see from the 21st to the 22nd, there's a 3-day change, there's a week change. So there can be enormous change in 1 day in a prediction that's 5 weeks out or 4 weeks out. And so we're seeing the same kind of volatility in these predictions to when we can unlock that we saw all along in the predictions of death. So why would we believe these predictions are going to settle into being something more robust and reliable when that hasn't happened? Here's just a couple of the things I've seen besides some of the papers I'm not showing you. Epidemiologists urge policymakers to ignore the widely cited UW model, calling it unreliable. That the IHME model keeps changing is evidence of its lack of reliability as a predictive tool. If it keeps changing, not all of them can be right, and therefore it's not reliable. That was actually somebody from the University of Washington. I love this one, that the results have been bouncing up and down like an unpredictable fever, kind of a nod at COVID, and that it's flawed and misleading. I agree, it's flawed and therefore quite misleading. And then epidemiologist from Harvard said it's not a model that most of us, meaning epidemiologists in the infectious disease field, think is well suited to projecting COVID-19 deaths, because it's not based on any mechanism or any interactions or any. It's a phenomenological model fitting, to statistical observed patterns, and we don't have a large collection of COVID pandemics that we can draw from over the last decade and really get good prediction. We have Wuhan, and now just some information from Europe, and that information's all over the place. You're getting very different patterns in Italy or Spain versus Belgium or France or Germany, and so trying to fit a statistical model based on that is really quite dangerous. So what's changed over the multiple releases? They've added more countries. They've added provincial predictions in Canada. They've changed their methods. They talk about multi-Gaussian kernels and how to handle the more flattened peak that they didn't predict, because their entire model is built on a very sharp peak, which it's not. And now they're saying we can start using this to predict when the disease will be at a low enough rate in the population that we can ease our distancing measures. But they haven't demonstrated that their model is stable and useful for predicting anything yet. And therefore, any further enhancements to predictions in other places or predicting other types of things, I think is just flawed and misleading and reckless. I decided that's the word. I think this is reckless. I think that the predictions are actually so unstable and so unreliable that doing 38 media contacts about it and not being much more upfront about how exploratory and unstable the model is does more harm than good. So some models are still wrong. Part 4, Chris Murray model, EndGame. Thank you for listening. I know that was a long and very deeply mathematical thing, and I have a Sweden update to do, and I have some other things I've got 2/3 finished, but I keep having to do my day job. So I hope you're doing well.